Hey there, it's Dr. Christopher Fox. This training or this video is really a discussion about calcium and vitamin D and a little bit on other nutrients for bone health. It's meant to supplement osteoporosis part 1 and osteoporosis part 2. So make sure to check those out if you haven't seen them already. So in the evaluation of osteoporosis, we get a lot of questions about, hey, how much calcium should I eat? What type of calcium should I consume? How about vitamin D? How about magnesium or vitamin K or zinc or boron? And let's talk about that for a minute. This is hopefully going to be useful to help you understand a lot of the basics so that when you and I get together, we are able to focus at a really high level and kind of dial in on your questions. So, calcium and vitamin D, very important for bone health. We know that vitamin D is needed to be able to build bone and needed to be able to absorb calcium from your diet, and that calcium is a building block of bone. As humans, we are meant to eat food. And so I think somehow over the last 15 or 20 years, there came this idea that we need to get calcium from a supplement, which it turns out isn't true at all. And in fact, we are, as people, meant to consume food, and we're meant to absorb our nutrients from food. And so the preference always is to get as much calcium from food sources as is possible. And then if needed, we can supplement that. You can supplement that with calcium supplements. Some people are intolerant or just don't like foods that contain a lot of calcium. But remember that we want to go food first, supplement second, just if needed. So at a very basic level, we could ask, well, how much calcium do we need? And so there's two numbers that I want you to remember, 1,000 milligrams and 1,200 milligrams. And so in general, 1,000 milligrams is recommended for premenopausal women and for men under the age of 70. 1,200 milligrams is recommended for postmenopausal women and men over the age of 70. So we need a little bit more calcium as we get older, likely because our intestines become a little bit less efficient at being able to absorb that calcium. So depending on your age, you can figure out in your mind whether you need 1,000 milligrams or 1,200 milligrams. And then keep in mind that that is a target for a population. So depending on your circumstances, when we chat and we do your evaluation, we may find that we need to adjust that based on your specifics. So for example, there are some women, particularly as women get older, and often women with low body mass, who just have a hard time absorbing enough calcium. And so sometimes we will shoot for a higher dietary target to make sure enough calcium is getting into the system. So we have a target. Next question would be, well, how much am I actually consuming? So I want to show you just one slide or one calculator here. It's just a way to estimate your calcium intake. And it's really simple and it's not perfect. You can find other calculators online, but this will give you a general ballpark, which is to say, if we add up all the cups of milk that you consume in a day, in general, a cup of milk, whether that is dairy milk or fortified alternative milk like soy milk or almond milk, a cup of milk will have about 300 milligrams of calcium. Now you can look at your label. Some of the almond milks have 450 milligrams of calcium. And a little tip is that the calcium, if it's reported as a percentage of RDA, that RDA is based on 1,000 milligrams. So if you see that it's got 10% of the RDA for calcium, you can translate that to mean 100 milligrams of calcium. So we add up the cups of milk, so however many times 300. We're going to look at how many servings of yogurt, 6 ounces of yogurt, also about 300 milligrams. Servings of cottage cheese, 8 ounces, has about 200 milligrams, or regular cheese has about 200 milligrams. And then the rest of your regular food has about 250 milligrams. Now, you might look, there may be some other foods that you consume a large amount of that contain more calcium, and so you can adjust this. But basically, we can add up what you get through the total here. And again, as we talked about just a moment ago, the goal is going to be between 1,000 and 1,200 milligrams, depending on your age and your gender. Okay, so calcium supplements. If you find that you are not consuming enough dietary calcium and you don't think that you can increase dietary calcium as a first choice, then calcium supplements can really be good to help get you to the target. Now, you may have heard, and calcium supplements have a bit of a negative reputation because there are some associations with an increased risk of vascular disease, things like heart attack or stroke, with calcium supplements. And this is probably true, and it seems to be most important when people are on very high doses of calcium supplements. So some women, for example, or men, find that when they find out they have low bone mass, decide that, well, I'm just going to eat a lot more calcium. So they may take supplements that are 2,000 or 3,000 milligrams per day. And that's really unnecessary and may have some negative consequences. So I don't want you to do that. But if we're talking about adding, say, 500 milligrams of calcium or 600 milligrams of calcium to get you to your target, that appears to have a very low risk and probably good benefit, because when we talk about treating low bone mass, we just want to make sure we're giving your body the best chance to be able to build all the healthy bone that it can. So we're trying to meet that minimum requirement. So you might ask, which calcium supplement is best? And this is something where the marketing in the world is a little bit ahead of the science. So every calcium supplement maker will tell you that theirs is the best. And there are always new ones being marketed that are touted as the latest and greatest thing. So what we know is that calcium really hasn't been shown to reduce the risk of fragility fractures. We talked about that in the osteoporosis training, part 1 and part 2. Calcium by itself, vitamin D by itself, hasn't been shown to reduce fragility fractures. But we do know that if these are below a certain threshold, then it's unlikely your body is going to be able to function normally to build healthy bones. We want to get you enough calcium and enough vitamin D. We'll talk about that here in just a second. So very commonly, calcium carbonate, one of the most common forms of calcium, it's fine to take. It has a lot of calcium per tablet. So typically to get 500 milligrams, you only need to take 1 tablet. And the one thing about calcium carbonate is it's not absorbed very well in people who have low stomach acid. So if you're taking a medicine that is a proton pump inhibitor like omeprazole or Prilosec or Protonix, Pepcid, famotidine, then you may not absorb calcium carbonate well. And in that situation, or based on your preference, calcium citrate is another common choice. Typically for calcium citrate, you have to take a few more tablets to be able to get a sufficient amount, and make sure that you check the label carefully. So a lot of the calcium citrate is labeled with a serving size of 2 tablets. So you might see that it's 630 milligrams. But if you look carefully at the label, the serving size is 2 tablets. So that's really 315 milligrams per tablet. So there are other sources of calcium. They are fine. I tend not to focus necessarily on which one is the best, but I just want to make sure that you're getting enough calcium. And as part of our evaluation, likely we will have you collect that urine jug for 24 hours to help assess your calcium absorption and see if we need to adjust this based on your individual level. Okay, let's wrap up with some quick thoughts. Vitamin D. Vitamin D, for most people, I just recommend 2,000 units per day. It seems to work well for the vast majority of people. And vitamin D we can measure in the blood. We can measure it in the blood, and we're looking for a target. Most vitamin D test results are reported in nanograms. I believe it's nanograms per milliliter. And we're looking for a number between 30 and 80. And so some authors, some people on the internet will say, gosh, it's got to be higher than 80. That's probably not necessary. Most of the science says that a level above 30 we would consider sufficient for bone health. Again, there might be some individual people that we shoot for slightly higher targets. And then finally, as we wrap up, get a lot of questions about other things. Hey, should I be taking magnesium? Hey, should I be taking vitamin K? Should we be measuring my vitamin K level? What about zinc, or what about boron? We know that all of these are important for bone metabolism. So the best thing is to have a healthy diet, a diet that's got whole fruits and vegetables, or whole vegetables and fruits. Typically, we prefer more of the vegetables. Vegetables and fruits, perhaps whole grains, other quality foods. will get you a sufficient amount. But if you're not certain, certainly taking a multivitamin to so-called hedge your bets and add some additional in there is not necessarily a bad idea, maybe a good idea for you. And if you have specific questions, just feel free to ask at the time of your visit, and we can talk through that further. So the goal for this was really to give you some basic ideas about calcium and vitamin D, how much you need to take, what's going to be the most beneficial for you. And hopefully this, again, allows us to focus on more high-level questions when you and I get together, because I'm hoping I've answered some of your questions already. And yeah, just make sure to get your registration form and your medical history form in prior to your visit. Those two forms are part of your pre-visit homework. And until we meet in person, I wish you peace. Take care.